Good afternoon, Senator, and welcome.
Thank you, and it's great to be here this afternoon with Mr. Chairman and members, and I'm certainly pleased to present to you Senate Bill 787. It allows Saddleback Memorial Medical Center in San Clemente, which we know as San Clemente Hospital, to continue operating the only emergency department located between Mission Viejo in South Orange County and the Tri-City Hospital in San Diego County in the city of Oceanside. It's a shy under 40 miles between the two. This bill is for the local communities around this hospital. Without this bill, the emergency department that is critical to at least 3 cities in South Orange County, and that has been there for more than 40 years, will likely be forced to close. San Clemente Hospital has unique circumstances, and contrary to what opponents have argued, and contrary to what I expect you will hear from them today, this bill does nothing more than address the unique circumstances of this hospital. SB 787 very specifically allows the owner of San Clemente Hospital to continue to provide local emergency care that the local communities want and need. It allows the emergency department to continue to operate after the facility is converted to an outpatient center, and specifically allows the emergency department to operate under the combined license of Saddleback Memorial Medical Center. Both Assemblymember Bill Breaux and I have attended several community forums, and we have participated in several stakeholder meetings in order to help find a solution that will allow the San Clemente Hospital Emergency Department to stay open as Memorial Medical Care Health System continues to explore a conversion of the facility. We have been extremely encouraged to have discovered a way to allow the emergency department to continue to operate. For those who may not be entirely familiar with South Orange County, San Clemente is roughly 15 miles south of Mission Viejo and is over 20 miles north of Oceanside and separated by Camp Pendleton. Mission Hospital Regional Medical Center in Mission Viejo has the next closest emergency department to San Clemente. The problem is that the average transport time to that hospital from San Clemente is already 17 minutes. But with a widening project underway on I-5, transport times can double and be over 30 minutes. And for any of you who have traveled through South Orange County on to San Diego County, you know that many times that road has been totally impacted and traffic has been stopped dead for hours on both sides of the freeway. So it is critically a need that we have an emergency center south of where those choke points occur. This bill is fundamentally about access to emergency care. Members, I think we can agree that more access to emergency care is better than less or none at all. If this bill passes, there will be more access to emergency care, and if it fails, there will be less. There is a strong support in the cities of San Clemente, Dana Point, and San Juan Capistrano for keeping this emergency department open. The bill is supported by emergency room doctors at San Clemente Hospital and by the Orange County Fire Authority, which transports 911 patients. This bill allows the owner of San Clemente Hospital to convert the facility based on an updated model of care while continuing to operate the emergency department that the community severely needs. With that, I'd like to introduce our speakers who have come up from South Orange County today. San Clemente City Council Member Lori Donchak, Dr. Stephen Cullen, and Tony Struthers, the administrator for Saddleback Memorial Medical Center, San Clemente.
Thank you. Welcome, and please proceed.
Okay. Good afternoon, Chairman Hernandez, members of the committee. My name is Lori Donchak. I'm a member of the San Clemente City Council. On behalf of the San Clemente City Council, I respectfully request your aye vote on SB 787. As you know, we are all here because Memorial Care Health System is planning to close and demolish its current hospital in San Clemente, depriving area residents of critical emergency care. Your approval of this measure will help ensure Southern Orange County residents continue to have access to quality health care, the very basic requirement for a strong community. Without this measure, the nearest emergency care will be a 15-mile drive north on the I-5 freeway, a road known where access and travel time is uncertain due to traffic congestion and road construction. There will be a 40-mile void in emergency care between Oceanside and Mission Viejo. As you can see by the map that was just handed out to you, the south end of the county is a hospital desert We're talking about the red box at the very lower right-hand corner of this map, and you can see that if that facility were to be shuttered, there would be very few choices for people in South Orange County. At the end of the day, it's all about people. And let me tell you about the thousands of people in the balance today. This is not your grandparents' memory of South Orange County. Consider this, 11% of San Clemente residents live below the poverty level. 11% are uninsured. This figure climbs to 15% in Dana Point and 19%, 1 in 5, in San Juan Capistrano. A full 13% of our population are seniors who have chosen San Clemente as a retirement destination with quality health care. San Clemente has a large homeless population because of our beach access, of which 12% are military veterans. We are the only emergency room serving Pendleton Marine Base, and additionally, we serve the 2 million beachgoers from all over the country. Our impeccable marine safety record is due in large part to the ER access, where minutes matter for a drowning victim. In short, your impartial positive vote on SB 787 will affect the well-being of a diverse and underserved population. Let me tell you why this appeal is unique, and unique to South Orange County. First of all, our geography. San Clemente is isolated when it comes to public services. We have the ocean on one side, we have Marine Base Camp Pendleton on a second side, we have Cleveland National Forest on the third side, and only the I-5 freeway passing through from San Diego to LA. People have few choices, and a no vote today takes away yet another one when it comes to health care. We also are preserving an existing emergency room, not creating a new one. San Clemente hospitals heal 15,000 emergency room patients each year. The hospital has been a part of our community, part of its fabric for 40 years. It affects the decision of every business or resident that chooses to live in this area. Finally, some have suggested that an urgent care facility is just as good as an emergency room. That is simply not true. An urgent care facility, unlike an emergency room, does not have to take all comers. They can refuse to treat those who are unable to pay. That is a key point. In closing, it's important to note that SB 787 does not propose changing the hospital and emergency structure throughout the state, but proposes a standalone emergency room solely to remedy a unique situation in South Orange County. As you decide, please also think about tomorrow. The new Rancho Mission Viejo development in the east of San Clemente is well underway, building 14,000 new homes. A regional retail outlet mall less than 2 miles from the hospital opens and promises over 1,000 new jobs. Your decision must weigh tomorrow's reality, which is one of growth, as well as today's acute needs. I've shared a litany of numbers with you just now and why they matter, but what truly matters is each individual life, which would be affected if San Clemente's emergency care is taken away. On behalf of our City Council, we respectfully request your aye vote on Senate Bill 787.
Thank you. Anyone else in support? Please state your name and position.
Thank you. My name is Stephen Cullen, and I've been a doctor for 23 years, and I've only ever practiced in San Clemente. Within months, not years, my hospital and emergency room may be closed. The 15,000 patients that Councilmember Donchek alluded to that we see in our emergency room every year have nowhere else to go. Our next closest hospital is a level 1 trauma center, which is already completely impacted. I-5 through San Clemente is terrible, with a construction project that just began that will take 3 years. A recent Caltrans report noted that 80% of the time the speed on that road is 35 miles an hour or lower. We're looking at hospital transport times to an emergency room that might exceed 30 minutes. If you're having a heart attack, 30 minutes is going to seem like days, and if you have a sick child, 30 minutes is going to seem like an eternity. I know of 4 children that have drowned in the last year in San Clemente. One of those children in the emergency room died after 3 hours of exhaustive resuscitative efforts. 3 of those children were put on breathing machines, stabilized, treated, and transferred up to Chalk Hospital a few hours later when they were more stable. And all 3 of those children were walking the very next day. And while I'm here to tell you that nothing completely saddens a hospital more than the loss of a child, I am certain that the other 3 children would have died without San Clemente's emergency room there. I know that there's concern about the difference between an urgent care and an emergency room, and that there's further concerns about the billing issues therein. And while everybody at this table is happy to answer questions about those issues, we're really here to tell you that this is not about that. This bill is about saving lives. We have a critical situation in San Clemente that puts more than 200,000 people at risk of not receiving emergency care. I've practiced medicine for 2 decades in 8 different countries, and I've seen people die of many things, including lack of education and lack of resources and even very strange practices of medicine. But I've never lost a patient because of traffic. Please don't let that happen.
Thank you. We are limiting to 6 minutes. The 6 minutes are up. If you can just state your name and position.
Yes, sir. My name is Tony Struthers. I'm a resident of San Clemente. I'm the administrator at Saddleback Memorial San Clemente.
Thank you. Anyone else in support? Opposition? Oh,
Connie Delgado with the California Hospital Association. We don't have an official position on the bill, but we do look forward to continuing discussions on preserving emergency services.
thank you. Opposition? Oh, is there support?
I have support.
Support, okay. Sorry,
Didn't have a chance to give my
I
support.
didn't see you.
Okay. Carol Wilson, I'm a community activist. This hospital has saved my life twice, and I'm hoping it's going to be there to save my life again. So I hope whatever happens to this bill today, that Saddleback will agree to keep that hospital open until we get a resolution. Thank you.
Thank you. Any else support? Opposition? Opposition, would you come up, please? And again, we're extending the same time as the opposition. We have a total of 6 minutes combined.
Chair and members, Michelle Cabrera with SEIU California. I will try to be brief. This bill would allow for creation of a freestanding emergency department in San Clemente because we have, on the one hand, a community that is obviously desperate to stop its hospital conversion from an acute care hospital with an emergency room to an urgent care center. This bill is not the answer, however, to the community's concerns, and it would establish a dangerous precedent in California. Let me be clear, a freestanding emergency department is a glorified urgent center. This is a deceptive mislabeling because if this bill is passed, the community folk, people who live near here, people who are wanting to access services, will reasonably expect that we saved this emergency room, and therefore we have access to these services. But what the facility will be missing is crucial. It will be missing surgery, it will be missing an ICU, and recovery services. Anyone truly in need of emergency services will, if they show up here, need to be transferred to an actual emergency room. And that will cost on a large scale. That additional transport time is now added because they had to be taken to this facility, assessed, and then transferred once more. The patient can be billed for the services in terms of transportation, and it's just a huge inefficiency. That we don't need to have this deception for people needing emergency services. The main difference here for the operator is billing, however. Urgent care centers cannot bill Medicare. Emergency rooms can. The state decides which is which. And so what we would ask is that we not put profits before the interests of the community by allowing us to convert this urgent care center by name only into an ER. We do not currently license freestanding EDs in California because it's bad for patient safety, and so we strongly urge your no vote on this measure.
Mr. Chair, members, Sarah Flocks from the California Labor Federation, and we're very sympathetic to the author and the sponsors that they want to preserve access to emergency care in this area. However, under existing California law, emergency service providers have to have all of the necessary services when someone presents themselves with life-threatening illnesses in order to be licensed under California law. With this bill, San Clemente would not have an actual emergency department. They would lack intensive care. They would lack a blood bank. They would really only have laboratory and radiology, which is not emergency services. And so we will have patients presenting themselves in what they think is an emergency room without the services there and having to be transferred. And so it is deceptive to have someone go in and pay for what they think is going to be an emergency room, and then having to be transported to get those services. So we're concerned about the precedent. We're concerned about our members in the area, and ask for your no vote on this bill.
Mr. Chair, Member Stephanie Roberson, on behalf of the California Nurses Association, also in opposition, couldn't say it better than my colleagues to my right on what this bill woefully lacks, but I can just state this really quickly for you all to remember. In order to be a licensed emergency department in the state of California, according to Code of Regulations Title 22, you have to have, as my colleagues have stated, intensive care services, laboratory services, radiology services, and surgical services immediately available. Also, post-anesthesia recovery and a blood bank. So with that, we need the patients in that area, patients all over California need this. It is the law. Those are the basics to run an emergency department in the state of California, and that's what's necessary. So we also are in opposition. Thank you.
Thank you. Senator, I'd like to make a few comments before we ask and open up for questions. I came in, listened to the proposal. I'm very, very sympathetic about the geographics of where the area is with regard to Camp Pendleton, I believe, to the south, and how difficult it is to get care there, and then to go down to on the Highway 5, which we all know traffic's getting worse. But I am concerned that this would be setting precedent to open up a standalone emergency without all the other services, and it's a significant change in how policy is set in the state of California. But because of this unique situation, what I'd like to ask of you is if you'd be willing to turn into a two-year bill. I am committed to work with you in the interim to have a hearing with the SEN Health as well, and I will reach out to the chair as well, find out how we can, if there's a resolution. Otherwise, I can't support it in its current form, so I'd like to know if that's something you'd be willing to do.
Yes, I'm certainly very open to that. I would like to make a comment, however, regarding the standalone emergency room concept as compared to what we are talking about here. There's I guess an allegation that there's going to be a reduction in the standard of care. And I think as we go forward, Saddleback Memorial Main Hospital, who has this as an emergency room, is certainly going to be addressing that in its totality. Or I believe that its license could be in jeopardy if it was not. So those are things I think during this study period, the interim, we can really address in terms of, do we have a model here that might address what we are seeing as a statewide issue with the lack of emergency departments within, a reasonable distance to access the care. We've heard so much over the last several months. I have my first opportunity to be back in the legislature about the challenge to care access, to medical care, with the dramatic changes we've just seen in the last couple of years. This is a significant one, and it's at the ground level. So I really appreciate the opportunity to take that time and let's look at it in its totality. And certainly standard of care, there's not a person sitting at this table who's in the medical profession, our doctors, our administrators, and certainly our community representatives that would ever want to see a diminishment of that, because then we wouldn't be saving lives with the tools that are currently available. It's how we knit them together to ensure that. So if you give us time, that's terrific.
And that's precisely why I'd rather do that, see if there's a resolution as opposed to opposing it just because of the unprecedented that we would be setting at this time, or the precedent we'd be setting at this time. So is there any questions for any of the members at all right now? Yes, Senator Nielsen.
Mr. Chairman, I thank you for your usual problem-solving way of doing business. That is a credit to you. You always do try to work some common ground. Senator Bates, would any of your witnesses have any knowledge of an argument related to the precedent, or at least for be in the minds of the committee as we proceed, maybe with an interim hearing or something?
I would like to ask our hospital administrator to address that.
Do you identify yourself, sir?
Yeah, Tony Struthers. I'm the administrator at Saddleback San Clemente. Obviously, there isn't currently a freestanding emergency room in the state of California, but what makes this unique is that we are part of a consolidated license. So what that means is we're one hospital on two different campuses. So we are viewed by all of the accrediting agencies, the state, Joint Commission, everybody who license and accredit us as one facility. So a lot of the services that we have are located on our Laguna Hills campus, and not every service is located presently on our San Clemente campus. So from that standpoint, what makes us unique is it is a consolidated license, and we aren't just a standalone hospital, so to speak, because we have our sister hospital in Laguna Hills, less than 15 miles away, because that's part of the criteria, that have many of those services that we're not able to offer on our campus.
And then, Senator, or any of the witnesses, as to the nature of the urgency and the emergency situation, I mean, the chairman's graciously offered to be paying attention to it in the interim as it be a 2-year bill, and I think that's a good solution today. But what is, say, the 2-year urgency here? What are we looking at as far as impacts?
We're looking at a financial challenge for the main hospital in keeping this open at the current patient census. And they are addressing that by creating actually a newer concept with it's going to be a medical campus with an advanced urgent care and with an emergency department as part of that design. And that, time is of essence, as we all know, with the money available and what you need to do to stay economically viable. So that's the urgency. We would intend to spend probably more likely our summer months to have the discussion with stakeholders and be ready to bring this back with Chairman's permission to discuss it the first thing in January.
Thank you.
Thank you. I believe there was, yes, Senator Nguyen.
Thank you. Senator Bates, there's, lots of comments from the opposition that there could be different services if this bill passes. Can somebody, maybe one of the doctor or the administrator, address what's the difference between the current service you have today and if this bill were to pass, what's the difference in the services?
Yes, ma'am. The simple answer is nothing. We currently would have the same physicians, the same staff, the same equipment, and the same transport system we have today, which is a private transport system outside the current paramedic system. And that system, which we provide that, we don't charge the patients for that. Every day we transport patients from San Clemente up to Laguna Hills for cardiac, for stroke, for OB. Those are services we don't offer on that campus in San Clemente. So at this point, the simple answer is really nothing changes. The only thing that's changing is that we won't have an operating room and we won't have inpatient beds. But as far as the services in the physical emergency room, absolutely nothing will change.
Okay. Thank you. And just one more, Mr. Chairman. There's also concern about patient safety. There were comments that, patient goes there, what they expect, and it's not there, and then you would have to transport them, and et cetera. Can you kind of address, is there a patient safety concerns, or, because for me, as, actually Senator Bates knows this, I served with her before, access to medical care, regardless, is extremely important for everybody. And I'd rather have 1,000 hospital than one for 3 million people. And so, for me, it's not about the bottom line. It's about making sure patients are safe, they're taken care of, and they have access.
Sure, thank you for giving me a chance to speak to that. Sure, if you have a hospital on corner A and corner B, and you have to bring someone to hospital A and only to transfer them to hospital B, why not put them in B in the first place? I understand that argument. But the problem here is that hospital B may be 30 minutes away. If somebody comes in respiratory distress, they need to be put on a ventilator in a matter of minutes. If somebody's septic and they're on a ventilator and they have a blood pressure that's 40, you can transfer those patients with medications to maintain the blood pressure. You can transfer somebody on a ventilator. You can transfer someone with a physician, with a nurse in the ambulance, and you can transfer them when they're critical, but much less critical when they were when they walked in the door. You cannot transfer a patient with an oxygen level that is below what is necessary to maintain, blood flow to the brain and adequate oxygenation of the brain. That patient will arrive with a pulse 30 minutes later at the next hospital, but with no brain. What we're saying is that in the unique situation that San Clemente faces, because minutes matter, and because it's so important to see a qualified emergency room nurse and a qualified emergency room physician and be evaluated and have the diagnostic tests done and triaged and treated initially, Then you have the luxury of transferring that patient 30 minutes later or a few hours later when they're less critical, when they're more stable, and when they'll survive the trip.
And Councilwoman, you made a comment about uninsured population and low income. Because, you know, most people, it's funny, coming from Orange County, when I first was there as a county supervisor, when I traveled across the nation and the state talking about Orange County, everybody's like, you guys are Newport Beach. You guys don't have anybody who's poor. And I tell them, actually, I represent a very poor district. Most of my children in my supervisorial district, which is 60% of my Senate district, 80% of them are on Medi-Cal or qualify for it. So I would go in and say, you know what, even in South County, anywhere else in Orange County, there are pockets and there are individuals who are low income, who are uninsured. So can you kind of, elaborate a little bit on that, and just in terms of the numbers so that I can understand, so that people know that we're not just talking about, the ritzy, so-called the OC. Yeah. That we portray on TV.
No, and that's important to understand, because many people think Orange County is everything you just described. And we have the uninsured, which are double digit. We have 11 to 12, it depends on which community, it goes up to about 20% if you include San Juan Capistrano in the conversation, below the federal poverty level. We also have an aging population that is disproportionate to the rest of the state because of our climate, and so we have those on fixed incomes that maybe made choices that put them into the underserved, underinsured category. So we have that. We also have a much more diverse demographic mix. San Juan Capistrano, which is served by this facility, is the second largest concentration of the Latino population in Orange County. And we've got the military component, which is a lower income component. So we're basically a very diverse population with great needs to be served with emergency care nearby.
Thank you.
Any other questions, comments from the members? Seeing none, would you like to close?
Thank you, and certainly thank you to the opposition for pointing out things that we really need to focus on. We're not closing our ears or our minds to your very, very legitimate concerns as we try to develop something here in this very unique situation. I thank you for your time, Chairman, and certainly members of the committee. We hope to return with something that you will be able to support, and we'll see you soon. Thank you.
My mistake, I think there was some individuals that just want to make some comments, just very brief, name and position on this bill.
Yes, Chairman Hernandez, appreciate your leadership on this issue, and I'm a registered nurse. My name is Deanne McEwen, currently the nursing practice specialist for California Nurses Association. I am an Orange County resident, having been a registered nurse for 40 years.
Just name and position, please.
Yes. I've worked trauma, ER, ICU, and helped develop the Orange County EMS system and the first training of the paramedics. So again, I would like to lend my expertise and work with you in opposition at this time. Thank you.
Name and position only, please.
My name is Margaret Lake. I'm a registered nurse, and I oppose the...
Thank you.
Kathy Dennis, registered nurse, in opposition.
Elizabeth Bataki, in opposition.
Thank you. All right. Thank you, Senator Bates.
Thank you.